Let me guess, you are having your Fachsprachprüfung in a couple of months and you don't know where to start with your studying. I've been there, I know it's very stressful, and I am here to help you. If you are a foreign doctor planning to work here, you probably know already about the Fachsprachprüfung, the medical language exam that tests your German skills before you can get your medical German license. The FSP means you have a C1 medical German skills. In this video, I will explain everything you need to know about the exam, also the Fachsprachprüfung, what the exam looks like, how to prepare for it, common mistakes, and useful resources. So stay with me and let's get started. What is the Fachsprachprüfung? The FSP is a medical language exam that foreign doctors must pass to get their medical license in Germany. It's not a medical knowledge test, it's a language test to see if you can communicate efficiently in a hospital or a clinic. For the doctors who come outside of Europe, they must take also the knowledge test. It's called the Kenntnisprüfung. In this video, I will talk about only the FSP. The exam is usually conducted by the medical chambers or Erste Kammer of the state where you apply. In Germany, there are 16 states. They are called Bundesländer. Each state might have slight differences, but the overall structure and format is the same. Let me explain the structure to you. Fachsprachprüfung is divided in 3 parts, each lasting exactly 20 minutes. The first part is doctor-patient conversation. You will have to take an anamnesis from a standardized patient. It's called das Anamnesegespräch. This is a role-play scenario where the examiner plays the role of the patient and you have to ask the right questions, show empathy, explain things clearly in German. So let me talk about my exam. I started introducing myself and asked the patient if he can talk slower and more clearly, because it's important for me to understand in order to help the patient. The madam doctor heard that I said that and started to speak like an old lady, and her accent was pretty bad. I understood almost everything. 2 times I had to ask her to repeat herself, but in a polite manner, of course. My case was angina pectoris, or angina pectoris, in English. I asked all the right questions and it took me exactly 20 minutes. At the end I said, I think I have all the information I need. Is there anything you would like to ask me? And her phone rang, meaning the 20 minutes have passed. And we all laughed because it was the perfect time. I was surprised too. I will put some resources in the description down below if you want to know what books and what sources I used to study for the exam. The second part, the medical documentation. After the anamnesis, you will need to write a structured medical report about the case. This should include the patient's complaints, medical history, your findings, and possible diagnosis and treatment. Clear professional German is very important here. There are medical history sheets for each federal state. They are a bit different from state to state. I live, for example, in Baden-Württemberg, and this was my sheet. I will put it right here so you can clearly see. You can choose to write on the PC or you can write it by hand, I advise you to write it on the computer because it's faster. I wrote more than 120 letters on the computer and I trained my fingers to write pretty fast in German. You have exactly 20 minutes for this part, no second more than 20 minutes. The third part, finally, you will present your case to another doctor and examiner. You must explain the case logically, using medical terminology, very important, and be ready to answer follow-up questions about the diagnosis and treatment options. While training with a professor, I used to do the case description or die Patientenvorstellung fully, meaning we started with the name and finished with the treatment. It depends on the state and on the commission if they let you do this or not. In my case, they had specific target questions, What is the name of the daughter? How old is the daughter? How many operations did the patient have? When? Why? Were there complications? in what year was that, what is the dose of the medication she takes, how does she react to penicillin, for example. So a lot of targeted questions. They want to see if you understand everything, or at least partially what the patient said. The commission was very, very, very nice. They were 3 doctors, all women, and they were very nice and sweet. Of course, I was very stressed, but the fact that they were nice helped me with the tension and anxiety. After around 17 minutes, the madam doctor said that she is done with the questions, and the other madam said there are still 3 more minutes. And she started asking a couple of questions, like targeted questions, but easy ones to fill those 3 minutes out. One very important thing about the third part is the explanation, or the Aufklärungen. That means that the doctor tells you to explain to the patient a procedure, how a procedure is done. Not everyone receives these questions, but some do, and I did. The doctor told me to clarify to the patient what the angiography is, and I had to explain. I learned the definitions by heart, meaning I knew them like a poem from start to end, and they heard that I know it very well and stopped me and asked again targeted questions like, will it hurt? Will I have to remain in the hospital after the procedure? Will I receive anesthesia? They want to see if you know what you are talking about, or you only learned it by heart. Luckily, I trained the last 3 weeks with a friend, Codrin. He had the exam 2 weeks before me and passed successfully. And those 2 weeks until my exam, we trained almost every day. After the doctor-doctor conversation, they give you 10 to 12 words you need to translate. That means from the German to medical German. For example, Schlaganfall, Apoplex, Anämie, Blutarmut, Bluthochdruck, arterielle Hypotonie. So you have around 6 to 8 minutes to finish the translation. After the third part, they invite you to wait outside of the room, and they decide if you passed or not. You wait around 10 minutes, but it feels like 1 hour because of the anxiety and and they invite you inside and discuss with you everything. In my case, they invited me inside, and for 5-6 seconds, they just looked at me and said absolutely nothing. And I was like, what? Did I pass? Tell me, I'm very nervous. And they laughed at me and said, of course you passed, it was obvious, They said they were impressed that in 14 months I was able to learn so much and speak fluently in medical German, and congratulated me. Then they spoke a little bit about what I could have done better and what I can improve. Here I realized that the madam doctor who pretended to be the patient spoke a very beautiful, clear German. But for the exam, she changed her accent to sound more difficult to understand. 4. How to prepare for your exam. Now that you know the structure, let's talk about how to prepare efficiently, and here are my top recommendations. Number 1, you need to improve your medical German. Focus on learning the medical terminology, especially for common conditions. A great way to do this is by using the AnkiBot or AnkiDroid application. It is a very, very easy way. You have the word, you say it, and then you press show and see if the definition was correct. If you said it right, you can press on show once a day, or after 15 minutes, or after 2 days. I learned about 1,500 words in total with this app, and in the last 3 weeks before the exam, I used to do 800 words each morning, and it took me around 45 to 50 minutes for 800 words per day. That means 1 word every 4 or 5 seconds. I knew the words very, very well, and it helped me a lot. And again, it depends on the state where you take the exam, because some words are used in one state and some are not. There are around 3,000 words in total, so if you want, you can learn all of them, or you can learn some which are closer to the state you take the exam. I took it in Reutlingen and learned all the words from the closest cities to Reutlingen. This is there is a Telegram group where people post their cases and information about the exam. I will put a link in the description below. There you can download the AnkiDroid, and I will show you exactly in this video how to do it, how to import your words. You need to download the Telegram and make an account if you don't have one already. And now press on the link in the video description. It will take you to the Approbation Baden-Württemberg. You can also search in the right upper corner Approbation Baden-Baden, for example, or another Bundesländer. Yeah, I think there is a group for every Bundesländer. Now join the group, and there are 3 categories: General, FSP, and KP. The FSP is Fachsprachprüfung, of course, and KP is Kenntnisseprüfung. If you have only the FSP, you enter the FSP category and press on the pinned message, and there is a zip file with all the protocols from Baden-Württemberg. You unzip it, you open Anki, press on import here and search a PKG file and import it. And here you can see the words, the translation. It is very good. If you also want the words as a printable PDF, you can find it in the Telegram group also. Practice doctor-patient conversation. Find a language partner or a study group where you can role-play anamnesis interviews. Practicing speaking out loud is the key. I worked with a friend, Kodrin, and we both passed the exam. Yeah, we trained das Anamnesegespräch, die Briefe, and the doctor-doctor Gespräch, yeah? And it helped us a lot. We did full simulations with all 4 parts of the exam, so including the Fachbegriffe or the translation. Number 5, common mistakes and how to avoid them. Many candidates fail the exam because of few common mistakes. Let's go through them so you can avoid them. Speaking too fast or too slow. Speaking at a natural pace is very important. Don't rush, but don't hesitate too much either. And learn the questions very well and make lots and lots of cases so you will know all the necessary questions and they come naturally. Using informal German. This is a professional exam, so you must use correct terminology. You need to talk respectfully. So using Sie and Ihnen and not du, dir, dich. Not showing empathy. Many people failed the exam because of this exact reason. You need to show empathy and say, for example, es tut mir sehr leid, das zu hören. Yeah, I'm sorry to hear that. Or ich bin sicher, dass es eine schwere Erfahrung war. I'm sure it was a very difficult experience. Yeah. Wenn Sie darüber sprechen möchten, bin ich für Sie da. If you want to talk about it, I'm here for you. And many, many more. If you want me to make a video about it and make simulations, I could make more videos about it, of course. Not structuring the case presentation properly. So follow a clear format. Main complaints, diagnosis, and plan. Yeah. And while making the anamnesis, try to have your questions in a structured way, meaning don't start with medication, then ask about if the patient has children, and then go again to medication, yeah? You need to make a structure in your mind and follow it. Misunderstanding the patient's symptoms. Listen very carefully. If you don't understand, ask the patient to repeat and clarify. Ask if you don't understand, and if you ask too many times, the commission will see that you don't understand. So you need to hear and you need to listen very well. Writing unclear and incorrect documentation. Stick to the standard structure and use short, precise sentences. This is how I made my anamnesis paper. You need to write what the patient said, and when the doctor asks you, you need to be able to find it very fast and easy. Let me show you how I draw my paper. If you want to download it, I will put everything in the Google Drive folder and share it with you. You need to draw that every time because you are allowed only one pen and a white paper sheet in the exam room. This is the structure. I used it, and if you want, you can use it too. I promise it will help you a lot. Number 6, recommended sources. To help you prepare, here are some great sources. Books. Fachsprachprüfung für Ärzte. I will put again a link down in the description below. Deutsch für Ärztinnen und Ärzte, and 2 YouTube channels I used, med.de online and Ärztesprech. These 2 channels help me a lot by listening to what they talk, what they say. Can you also improve your German listening skills? So the Fachsprachprüfung can feel challenging, but with the right preparation, you can definitely pass. The key is consistent practicing, speaking, writing, and thinking German as much as possible. I passed my exam in 14 months and I started with 0 German skills. I started with A1 and learned until B1 alone. For B2, I had to take a course to pass the B2 exam. If you found this video helpful, give it a like and subscribe for more medical content. If you have any questions about the exam, leave a comment down below, and I will do my best to answer or make more videos about the exam and maybe give you more useful tips and tricks. Yeah, so good luck with your exam, and I will see you in the next one. Good luck, guys.